The NHS in England expects a 30 billion funding gap in 2020. Its Chief Executive, Simon Stevens, has called for a radical upgrade in prevention and public health. He hopes if we all lived healthier lives, the burden of chronic disease would fall, reducing demand on and costs for the NHS. This idea, of course, is not new and is frequently advanced by public health professionals. But is it a fair assertion that the burden will fall if we lead healthier lives? Let's unpack this a little more, focusing on one behaviour, physical activity, and one disease, dementia. If an individual is physically active, their risk of developing dementia is lower. If a population is more active, all other things being equal, the risk of developing dementia goes down, the incidence at any particular age goes down, so you'd expect a lower burden of dementia. However, there's a second process which I think people tend to forget, and that is that physical activity affects the risk of the development of many other diseases. And some of these diseases, such as cardiovascular disease, will have an effect on life expectancy or longevity. And this, of course, will result in more people living to an older age. And old age is the biggest single risk factor for development of many chronic diseases, and particularly so for dementia. So this second process will tend to push the disease burden up. Part of my PhD is about exploring the relative importance of this second process on estimates of the burden of different diseases. Now, in doing this work, we need a clear definition of what we mean by the burden of disease. And because I'm interested in the total demand that a health service might experience, I want a definition that encompasses both the total number of people with disease and how long those people live with that disease. So I'm defining burden as the person years live with disease when I'm doing this when I observe a cohort from birth through to death, recognizing that burden may be pushed into the future. So to understand the effects of these two processes, reduce risk and increase longevity, we've developed a multi-state life table model that describes the effect of change in physical activity on the burden of diseases for which physical activity is a risk factor. What have we found? This chart shows our model's estimates of percentage change in the burden of different diseases if everyone in the population undertook a little more physical activity, equivalent to an additional 20 minutes of walking each day. Now in this graph, reductions in disease burden are shown below the line as negative figures and an increase above the line as positive figures. The blue shown here is the simple model, where we only consider risk reduction and don't consider the longevity effect. And this approach to modelling is relatively common in some areas of public health. The red shown here is our central estimate where we consider both the effect of risk reduction and the effect of longevity. And while the general trend for the change in burden is still downwards, we can see our estimates for reduction in the burden of disease are more conservative than under the blue model or set of assumptions. However, we think the model shown here in red may be underestimating the longevity effect, and we can model a more pronounced longevity effect, which I show here in green. And here not only do we see more conservative effects in terms of reduction in the disease burden, but the model suggests that burden could actually increase for some diseases, some cancers, and dementia. So in summary, for physical activity, we're finding two things. First, when our model considers the longevity effects, our estimates of reduction in disease burden are more conservative than they otherwise might be. And second, for some diseases for which physical activity reduces risk, it is possible that increase in physical activity might lead to an increase in the burden of that disease. So why does this matter? Well, it helps us develop better tools to understand the potential effects of preventative and public health interventions. Not simply whether the disease burden goes up or down, but by how much, when those changes occur, and also understanding whether the burden may shift between different diseases, as we saw in this example here. Now, clearly there's a lot more we could discuss. This analysis here doesn't demonstrate or consider the benefits of delaying the disease onset. And returning, or in terms of thinking about my substantive question about costs and savings to the NHS, we really need to move beyond burden and start to think about costs of these different diseases, and that's something we're working on. So while I haven't yet answered my substantive question, what I hope I have achieved today is to show you that the longevity effect can be important when we undertake this modelling work, and that this technique or this piece of work can shed some insights into that substantive question. Thank you.
Thank you very much. Is there a question for Oliver?
This might be a bit of a naive question, but I'll ask it anyway. From a policy perspective then, given all of this, do you think it's important then to encourage physical activity as a public health issue?
Yes, I do. I mean, as I say, I'm thinking more about what it means to the health service. And part of where I'm perhaps beginning to think about this is, whilst I think there are legitimate cost arguments in here, but we need to tease those apart a bit more, I wonder if more of the focus needs to be on physical activity as a good in itself in terms of the health effects, rather than selling it as this is going to save the NHS lots of money. That's still possible, and it needs more unpacking. But there may be an argument for focusing more on health for health's sake.
Thank you.
Carol, we said you weren't allowed a second question, but perhaps as it's you. The final question.
Actually, it's not a question, it's just a reference back to the discussion about end of life, because dementia is often associated with end of life. So it may be that we need to think about this in a slightly more complicated way than policymakers and modelling allows at present, to take that into account.